and when I look at the Expert Task Force on Substance Use, the Canadian Association of Police Chiefs revealed, they obviously put out their policy platform a few years ago, what they were commanding. The Chief Coroner of BC First Nations Health Authority, now the Death Review Panel in BC. It's unbelievable. We have a Death Review Panel on this issue. But they all have something in common. They've all cited that we need treatment on demand, recovery, prevention, education, and a safer supply of substances. They've been all unequivocally clear. Has any of them changed their position when it comes to safer supply, since that's been brought up earlier in this conversation that you're aware of?
I am not aware of changed positions. We are aware that there are a range of differing perspectives and reports in terms of prescribed pharmaceutical alternatives. But as you mentioned, it really is one action of multiple, no single action.
And the reason I'm just bringing that up, because it was raised earlier, and when I talk about safer supply to replace the toxic unregulated drug supply that's killing people in our country, have you brought together the data of the pilots? Like, I know that Dr. Sereda in London, Ontario, she's producing data, and the data is significant. Lower visits to hospitals, less hospitalization, less involvement in survival sex work and drug-related criminal activity for drug-seeking related crime. I mean, this is unbelievable, the stats that are coming out. Have you compiled these and released the data of all the SUAP funding so that people have a better understanding of how successful these pilots are working?
So there is absolutely quite a bit of data. I mean, we are collecting data. We are evaluating programs, and so there is a number in terms of prescribed safer supply. There are prescribed pharmaceutical alternatives. My apologies. There are a number of studies underway. There's over 30 published evaluation results. Some of them are quite promising. The London study, as you mentioned, is one of them. The Ontario Drug Policy Research Network identified 20 publications and looked at promising outcomes, including reduced visits to emergency departments, hospitalization, reduced overdoses, reduced illegal drugs. There's a number of evaluations that have been undertaken by CIHR and the Canadian Research Initiative for Substance Misuse, CRISM, looking at the effectiveness of supervised consumption sites, of a number of different, Section 56 exemptions.